Hi, everybody. My name is Maya. I'm the dietitian at the Cardiac Rehab Clinic, and I'll be going over nutrition before cardiac surgery. So why is nutrition important before? Well, first, it can help improve healing and recovery and can help you go home faster, reduce the risk of complications, improve overall strength, energy levels, improve your blood sugar during and after the surgery as well, and can help reduce the risk of cardiovascular event or diseases. The first part, I'll be going over what a balanced nutrition looks like, protein, alcohol, and natural health products. Part 2, I'll talk briefly about diabetes, anemia, and weight. And part 3, again, I'll mention briefly the preparation for the day of the surgery, although it really depends on the hospital and the healthcare team, what to expect after your surgery, and a brief summary of everything. So first of all, how do I achieve a balanced diet? So the easiest way is to refer to the balanced plate from the Canadian Food Guide. What they recommend is that a quarter of the plate should have protein, a quarter should have whole grains, and half the plate should be fruits and vegetables. So when we talk about protein, we're talking about animal-based, plant-based, dairy products, nuts and seeds. When we talk about whole grain, it's any brown bread, brown rice, fruits and vegetables, really any fruits and vegetables are recommended for all kinds of vitamins and minerals. Make water your drink of choice. So what that can look like, for example, you're having a quarter of the plate chicken, a quarter of your plate should be brown rice, and half your plate should be a salad. If we eat like that, usually we tend to have enough protein for the day. If we're having, for example, 3 meals that resemble that, we have enough vitamins and minerals and enough fiber as well. It doesn't mean that we all have to eat that way, but definitely that could be the easiest way to achieve the most balanced plate and nutrients throughout the day. So first and foremost, for protein, your body uses protein to grow and repair cells, make hormones, which carry out key body functions, like insulin, for example, which controls your blood sugar, is actually a hormone, which is a protein, and can help support muscle mass and movement. So overall, for surgery, it's very important to help repair your tissues and improve your muscle mass. Which foods contain protein? So I briefly touched upon a few of them, but animal-based proteins, for example, chicken, red meat, fish as well, nuts and seeds, plant-based proteins, so legumes are lentil, beans, or chickpeas. You have dairy and you have soy products as well. I also put a little note for whole grains. So whole grains do have protein as well, although it might not be as much as the other foods that I just mentioned. Usually fruits and vegetables don't contain a lot of protein. So how much protein do I need before a surgery? So it really varies. Usually the recommendation would be about 1.5 grams per kilogram per weight. So for example, if you weigh 80 kilograms, you would need to do 80 times 1.5, and that gives you about 120 grams of protein per day. Food sources include, for example, 2 eggs would be about 14 grams, a tuna can be about 30 grams, 1 cup of chickpeas can be about 11 grams, 1 spoon of protein powder is about 20 to 25 grams of protein. Be careful, there's a little note at the bottom. Increasing your protein intake may be contraindicated for certain conditions like kidney disease. So speak to your dietitian and doctor before making any changes. So 20 grams of protein per day, which is 1.5 gram per kilogram per day for someone who weighs 80 kilograms, can be quite a bit of protein. Again, speak with your doctor, dietitian if you have other health conditions you might need to consider. So how should I increase my protein intake? The simplest way would be to increase the quantity on your plate. Instead of having this much chicken, have a larger portion of chicken. That can be the easiest way to do it without having to calculate anything, without having to count anything. Just to be mindful at every meal to increase the quantity could be enough. Otherwise, if you would like to count, you can look at the food labels. So for example, if we're looking at the soy milk, 1 cup gives you about 7 grams of protein per cup. And if we're calculating it, you might need to do that for every food item. And you would aim for about 25 to 35 grams of protein per meal. That's if you're aiming for 120 grams of protein per day. And about 10 to 15 grams of protein per snack. What does that look like? For breakfast, for example, it could be 3/4 cup of Greek yogurt, which is 19 grams of protein, 1 tablespoon of hemp seeds, which is about 3 grams of protein, half a cup of berries, which is only 1 gram of protein. So again, fruits and vegetables are pretty negligible for protein intake, and 1 egg, which is 7 grams of protein, and that gives you 30 grams of protein for your breakfast. You do that for every other meal, and that gives you a total of 120 grams. So you can really see that you don't necessarily need to focus only on chicken, on animal-based protein. You get protein from different food sources. As long as you're varying your protein sources, you should be getting enough of good quality protein. So what you want to consider as well is a heart-healthy diet. A heart-healthy diet can be quite simple if we know the basic rules. So first of all, heart-healthy fats include unsaturated fats. So these are the good fats: nuts, seeds, olive oil, any oil, canola oil as well, avocado oil, avocado on their own, fish, any fish. All of these foods contain a lot of unsaturated fats, which are the good fats. Fish contains certain of them. For example, salmon will contain omega-3, which is a type of unsaturated fat that is you find only in food. You don't necessarily need a supplement for that. If you're eating fish, then it should be enough omega-3. For example, fish twice a week, that should be enough omega-3. A supplement doesn't really help heart disease from what we've seen. So overall, it's always better to take from food rather from supplements for heart disease. Saturated fats are the fats that we recommend to limit, and they have a different molecular structure. So they are normally solid at room temperature. And for example, think of butter, think of coconut oil. They increase your LDL, so your bad cholesterol. And the food sources are normally red meat or dairy: beef, lamb, pork, poultry with the skin, butter, high-fat dairy products, fried foods, and palm and coconut oil. So again, the oils that are more solid at room temperature. Dairy products aren't as harmful in terms of their saturated fats as red meat. However, we still recommend that you are mindful of the quantities that you're having. Vitamins and minerals. So vitamins and minerals play an important role in recovery and help with wound healing. Zinc, iron, copper, calcium, selenium, vitamins A, D, E, C, and K, and along with other vitamins and minerals that aren't mentioned here. The idea is not to necessarily take a supplement unless you are deficient, but it's to eat a variety of foods, include legumes, nuts, seeds, fruits, and vegetables, and consider a multivitamin if the food intake is inadequate. A multivitamin will have very small quantities of different vitamins and minerals, but it could be better than nothing. For alcohol, we recommend to stop alcohol 4 weeks before surgery. So according to the guidelines of perioperative surgery, alcohol consumption has been associated with an increased risk of respiratory, wound, bleeding, metabolic, and infection complications. Alcohol abstinence for 1 month are associated with improved post-operative outcomes after surgery. So the idea behind it would be to limit your alcohol as soon as you can. You don't know when your cardiac surgery will be. It might be in a few months, it might be in a week, it might be in a year. Usually they'll call you and tell you your surgery is next week. And that's after waiting months to a year. The idea really is to start taking care of your health as soon as you can. This graph is showing that every additional drink, every additional glass of alcohol can increase the risk of cancer, cardiovascular diseases, stroke, etc. Whether it be alcohol, hard liquors, whether it be wine, hard liquors, really any percentage of alcohol is not associated with benefits. And that's according to the Canadian Centre on Substance Use and Addiction. The recommendation goes back to 0 alcohol. Natural health products. So some supplements can increase the risk of surgery or procedure because they prolong the effect of anesthesia, increase the risk of bleeding, raise blood pressure, interfere with other medications. Natural doesn't always mean safe. It may be recommended that you stop taking the supplements 2 to 3 weeks before your surgery. Make sure that you ask your pharmacist, tell your doctor, your healthcare team which supplements you are taking. Again, natural doesn't always mean safe. Sometimes something as simple as garlic can help increase the blood thinning, or for example, vitamin E as well is not recommended to take around surgery time. Overall, again, we talked about the increased risk of bleeding, something as simple as garlic. So the idea is to really make sure that you are minimizing any extra supplements that you may not need at the moment. Part 2, diabetes. Right now, I'll talk briefly about blood sugars. Around 10% of people undergoing a cardiac surgery have undiagnosed diabetes. The idea is to discuss with your doctor your blood sugar levels. So I won't necessarily be going into diabetes teaching. It's just to make you aware that controlling your blood sugar can decrease your inflammation, improve your, lead to faster recovery, lower risk of infection, fewer complications, can help stabilize your blood sugar. So avoid the highs and lows of blood sugar during and after your surgery. And you can manage that, your blood sugars overall with diet, monitoring them. So if you have access to a glucometer, a blood sugar, to check your blood sugar on your finger, any kind of continuous blood sugar monitor can be helpful. Medication, staying active. And that applies, again, if your blood sugars are not as managed as we would want them to be before. Again, I won't be going in details for diabetes, but one aspect to consider amongst many, many aspects would be carbs. So how much carbs are you having? You can look at the food label. What type of carb are you having? So usually we recommend the carbs that have more fiber in them. And how do you know what has fiber? You can look at the percent daily value. So for example, the percentage on the right shows you that this bread has over 15% of fiber, which means you're having, again, if something has 15% fiber, it means you're having 15% of the fiber that is recommended in a day. The higher the percentage, the better it will be. Anemia and iron deficiency. A lot of the time after surgery, I will see that the iron levels are lower and that people tend to have anemia. Anemia is defined as hemoglobin levels of less than 120 for women and less than 130 for men. Iron deficiency is usually defined as ferritin levels less than 30. It could be less than 50 as well. Overall, you want to make sure that everything is managed before your surgery, because usually after the surgery, it could be due to blood loss, could be due to many reasons. A lot of the people will, their anemia levels, their hemoglobin levels go down. So discuss with your doctor your anemia profile before getting into surgery. The treatments can include increasing your iron, B12, B9, taking a supplement, intravenous iron. It really depends on the severity of it. What about weight loss? So sometimes you'll have a doctor tell you that you have excess weight you need to lose in order to improve your heart health. The pros is that it can help you improve your heart health by helping control blood sugars better, your blood pressure, other cardiovascular risk factors, facilitate movement depending on the severity of the excess weight and where it is. The cons: before surgery, you want to make sure that you do it safely. So if you're losing weight, you can risk losing muscle loss as well. That can increase the risk of surgery complications. There are risks associated with weight regain if you do it too rapidly, and usually weight cycling. So losing the weight rapidly, regaining the weight, losing it, regaining it, all that kind of weight cycling can increase the risk of cardiovascular disease as well. So should I try to lose weight? Before a surgery, I don't recommend you focus on that. Again, even after a surgery, there are other ways to measure health. But before a surgery, I would recommend that you try to focus on maintaining your weight, maintaining your health, because after a surgery, you can expect that you will lose weight. It depends on the person. So sometimes some people lose appetite, people might lose 20 pounds after a surgery. So you want to make sure that before you're not doing anything to risk an excessive weight loss or causing nutrient deficiencies as well that can happen with weight loss. Preparation for the day of surgery and right before surgery. I will leave that to the healthcare team, depending on the hospital that you're in, because every hospital will have a different protocol. According to the guidelines, however, you could still eat 8 hours before surgery, and usually it's lighter meals that we recommend. So stop all heavy foods, fatty foods, meat, stick to lighter meals. 6 hours before Stop all solid foods and only stick to clear fluids. And 2 hours before, you want to stop everything, all solid and all liquids. So technically, you are allowed to eat up to 8 hours before, but depending on the hospital, depending on the protocol, they might make you stop eating longer, to 12 hours, 24 hours before. What can you expect after your surgery? In general, again, according to the guidelines, you can eat normally a few hours after. You might expect, but then it depends on the hospital. So a lot of the times people will be put on liquid and then will gradually start eating solid foods. You could technically start eating solid foods directly, but it really depends on the hospital. It depends on the protocol. It depends on your surgery as well and how it went. So always speak with the healthcare team and feel free to ask them questions if you're unsure. What can you expect a few days to a few weeks to even a few months after? Loss of appetite, loss of taste, depending on the surgery and the procedure, it can impact your taste buds. Digestive issues, so vomiting, nausea, constipation. A lot of the time you'll be put on different medications that you might not have been on before, and that can a lot of the time lead to constipation. Weight loss, if you're not eating as much, if you're not moving as much in the hospital. Sometimes if complications do occur, you might stay longer in the hospital. Supplementations for any deficiency that you may occur because of the surgery. This doesn't mean that it will happen, all of the side effects I just mentioned, but it could be quite common, and we do see it often, and usually it resolves a few weeks to a few months after. So the summary of goals is that you want to ensure adequate protein intake for muscle repair, maintain your balanced blood sugar levels if they are not unmanaged, aim for a balanced diet, a heart-healthy diet, and avoid alcohol consumption when you can. This is your nutrition checklist in preparation for your heart surgery. So the first thing, I consume enough protein, usually around 1.5 grams per kilogram per day. Again, it depends on your condition. Speak to your dietitian or doctor if you're not sure. I follow a heart-healthy diet. Usually it's a high intake of fiber and unsaturated fats, low intake of saturated fats and sodium. If I consume alcohol, I will aim to reduce my intake to 0 as soon as possible before my surgery. So again, you don't know the date of the surgery. The idea is to make sure that you prepare as well as you can before. Even the protein, try if, for example, you feel like you're losing a bit of muscle loss, you can increase your protein as soon as you can, as you want. I will review the following. If I have diabetes, do I feel confident that I'm managing my blood sugar levels effectively? If I have iron or vitamin B12 deficiency, am I taking the necessary steps to address it? If you're unsure of the above two questions, ask your family doctor to get tested. And finally, I will inform the healthcare team that I'm taking the following healthcare supplements and products, and it is recommended that you write them down. They usually have your medication list, but they won't always have over-the-counter products. So make sure you have a list of those as well. So everything applies. If you're able to apply that 1 month to 2 months before your surgery, you should be ready. Again, you don't know the date of it, so as soon as you can, start applying the recommendations. But if you know that your surgery date is 2 months from now and you start today, you should be ready for nutrition-wise for your surgery. And if ever you're looking for more tips, you can book a consultation with your dietitian and try to speak with your family doctor if you can have access to a dietitian if you're not at the prehab clinic. Nutrition resources, so guides, recipe links, nutrition videos, nutrition tips, and recipe books are all listed over here. And overall, thank you very much for listening, and I wish you a very safe procedure as well.